evening. I'm Navya Mrig. I'm an 11th grade student and I'm the founder of Saahas, which is a non-profit organization which aims to raise awareness about public health issues. And I've been working towards raising awareness about organ donation for the past couple of years. As So said, that's what this talk is about today. Due to this important issue of organ donation in our country and to sensitize the public about its importance and how you can show a little bit of Saahas to create change in our country and save millions of lives. At Saahas, we conduct awareness talks. I even do podcasts and campaigns to raise awareness about important issues. I don't just talk about organ donation, I'm also trying to raise awareness about cervical cancer and immunization. So these have been some of our events. This was the first event that we held. This is one of my recent podcasts with a recipient of kidney transplant. And this is one of our talks at Power Grid.
It's been almost 4 years.
So you can see our podcast on the YouTube channel as well. This started out because of my mentorship from Organ India, which you might have heard about if you know about organ donation. They've been doing a lot of great work related to organ donation since 2013. And in collaboration with them, I was motivated to start Saahas since I felt so passionate about this issue. So Organ India started as an initiative of the Parashar Foundation, and since 2013, they've been focused on creating awareness and providing opportunities for people in need of transplant and also the recipients. So what is the need for this talk today? In India, there's actually a very big lack of donors, and it's very imbalanced, as you can see by this visual. There are so many people in need of the transplant, but the donors don't match those numbers. And like Sir said, there are so many people who end up dying on the waiting list because they're not able to get any donors. So these are just some statistics for you to get an idea. There are 3 lakh patients who are on the waiting list, and 1 person is added to this list every 10 minutes. And 20 people die every day waiting for an organ because of the paucity of donors in our country. So there are actually 2 types of organ donation, living and deceased. Living, you might have heard, liver and kidney in most cases. But deceased organ donation is the problem that our country is facing. It's the issue of living donors, which is actually much more effective since you can donate so many of your organs when it comes to deceased organ donation. So you can actually save up to 8 lives, which is what makes deceased organ donation so important. So you can impact so many different lives by just taking this one important decision. And to compare with some of the other countries that are doing really well in this area, Spain you can see, and US as well, they have very good rates of deceased organ donation, but when you compare it to India's, it's only 0.8 per million, which is not nearly enough to cover the number of people who are in need of transplant, which is why this is such an important issue today. You can see that there has been we've been trying to improve the rates in India, but it's not nearly enough. And this is why the public needs to know more about how we can do our own part in improving these rates. So a lot of people aren't aware about this whole process, and they're quite confused about how to approach it, how to go about it. So that's the gap that I'm trying to cover today. So just to brief you about the process of organ donation, when it comes to deceased organ donation, this is actually only possible when there is brain death. So brain death actually occurs when there's damage to the brain. This is very frequent in road traffic accidents where there's a hemorrhage, and this is when the brain is severely impacted, and that's when the doctors declare a person as brain dead. In this case, when they're admitted to the hospital in the ICU, they can be put on ventilator to preserve their vitals. But even then, families need to accept the fact that after brain death, chance of revival is zero. And even if you might be able to hear their heartbeat because of the ventilator, um, you need to make this important decision because you get a very small window during which the family makes the decision of whether to donate the organs or not. And this is quite a sensitive topic, so the doctors try to approach it with sensitivity and support. But if all of us already knew about organ donation and this process, then it would be so much easier. So it's actually the family that gives consent during a person's demise, and that's when all of the people who are in need of transplant are identified from the waiting list, and then there's a short window when the organs are delivered to them. So, like I said, brain death, it results from severe irreversible injury to the brain. Um, and they cannot sustain their own life, but the vitals are sustained through artificial support system. But that doesn't mean that they can be revived. So this is a very important thing to clarify, which leads to the decision making during that moment. And this is when all of their organs can be surgically removed to help 8 or 9 lives that have been on the waiting list. And in the case of cardiac death, which is more frequent, which would be from cardiac arrest, heart attack, as we've all heard, you can't donate all of these vital organs, but it's important to know that tissues like cornea and skin can also be donated in the case of cardiac death. So we also need to have awareness about this in that case. Yeah, so if a person dies at home or anywhere else and their heart stops beating, then it won't be possible for them to donate their vital organs, but the tissues can still be donated. Yes, so I've already explained brain death, cardiac death. This is just a visual to understand that brain death, that is a crucial time where you need to take action and you need to be prompt, and that's when all the organs can be donated. Otherwise, during cardiac death, only the tissues can be donated. So that includes bones, skin, veins, blood stem cells, blood and platelets, and also tendons, ligaments, and recently there's also been hand transplants for the disabled. So even this is quite important to know. So a panel of 4 doctors and actually declare brain death. So this is something that you can be very sure of, but the family should also be aware of this. So you have to take this decision when a person is declared brain death, and you might have heard of a donor card that is issued from NATO, which is the National Organization of Tissue and Transplant. So they will issue a donor card, and this is basically to show your intention of donating your organs after death. And if a person already has a donor card, then it becomes very easy for the doctors to approach them because their family would already know that they have this intention, and that's when this is when it becomes crucial, when you get that small window after brain death. And the family needs to make this decision. So it's very important that even if you're thinking about donating your organs after death, that your family knows about it and you talk about it with them. So this is the donor card that is issued by NATO, and you can easily sign up for it by just filling out your information. And what a lot of people actually do is that they display it either in their office or in their homes, so that people who come to those places know about their intention, and they're able to passively spread more information about this. So my father, when he got the donor card, he actually framed it and he put it up in his clinic. So that's when all of his patients or all the people who came to his clinic knew about how you can get a donor card and about his intention of donating his organs after death. So I would also encourage you to take small steps to not just do this yourself, but also spread awareness to other people like your friends and your family. So now I just wanted to discuss some common myths and facts, because this is a very sensitive topic in our country, especially when there are so many biases and misconceptions, especially related to religion. So I wanted to do a little test. So I'll tell you some statements, and I want you to raise your hand if you believe that this is a fact and that this is the truth. So this is just to test the general knowledge about organ donation. So you must have heard that नहीं अब हमारी मतलब एज बहुत ज़्यादा हो गई है तो हम ऑर्गन्स नहीं डोनेट कर पाएंगे, या हमारा कोई क्रॉनिक इलनेस है तो हमारे ऑर्गन्स को यूज़ के नहीं होंगे. If you believe this or if you've heard this before, can you please raise your hand? Or there's also a common misconception that अगर हम इस life में if we donate our organs then we won't get them in our next life. Have any of you heard about this?
People do say that.
It's a common thing in India for these misconceptions to spread, especially since this is a stigma or a taboo topic. So that's why it's so important to know that what's the difference between myth and fact, and to get the proper information about this. So once you sign up to be an organ donor, you can easily change your mind, and this is something that's a personal choice. That's why you can change your decision anytime, and it's not binding. So you're not restricted by any of that. There's also a common misconception that you're too old to donate and nobody would want your organs or they won't be useful. This I've heard a lot when interacting with people, whether it be, in the rural areas or even in the urban areas. This is a very common myth. But there's actually no specific age limit for donating your organs, and they've been transplanted from people who are well in their 80s as well. And there are very few illnesses that would actually disqualify you from donating your organs. So this is something that everyone should know. Also, there's a misconception that my family will be charged if I donate my organs, because they think that there will be a cost to this procedure of getting the organs surgically removed. But the truth is that the family is not charged for any of those procedures that involve surgically removing the organs, and it's just the ventilator or the ICU bill that is charged to the family. So there's no extra cost for donating your organs. And there's also a myth that patients with chronic illnesses cannot donate their organs, but like I said, there are very few conditions that would actually disqualify you from donating your organs. So it's important to still think about it, even when you think that you're too old or you have chronic illnesses that wouldn't make you qualified. Some other things that I've also heard recently from people are that celebrities or important famous people are given priority on the waiting list, but there's no criteria like that, and it's entirely based on the need and the timing. So it's very important to know about what's the difference between myth and fact, and you can find out more about this on my website, where I have more FAQs, more myths versus facts, so that people can get the proper information related to this topic. And yeah, like I said, I would strongly encourage you all to think about this, because this is a very small step that we can take to make a difference. And we're going to be handing out pledge forms if any of you choose to pledge, because usually it's a little complicated process where you have to either sign up at a hospital or fill out multiple forms, but I tried condensing it all into one form that can be filled easily. It's there on my website as well, but if you filled out the physical forms here, then I'll email all the information to Noto, and you can get the donor card issued easily here itself. And there's also a booklet that I have created to basically provide more information to the public about more of this, and going into the intricacies of legality, and about what rules are there in organ donation. So you can also scan this QR code if you wish to fill out the form online, but we will be handing it out. So I'd urge you all to think about that and make this important decision. Like I said earlier, I also have a podcast where I interact with donor families, recipients, and medical professionals who are professional in this field. So if you would be interested in that, I'd urge you to check that out on YouTube. It's called Saahas Stories. So that would be it from my side today. Like I said, please think about this and fill out the donor forms. Thank you.
Thank you, Navya, for such encouraging words. What better than a huge encouragement can be for a young chap that Director Noto himself is here, right? So I welcome Dr. Anil Kumar sir. He is a brand ambassador of NIHFW, an old alumnus, a friend of the institute, and he is always available whenever we request whatsoever efforts he has to make. Today also he was having a quite important training going on, but he has considered our request. Sir is Director Noto, sir is National Director Noto for, that is National Organ and Tissue Transplant Organization, DGHS, Ministry of Health, Government of India. Sir is Head National Organ Transplant Program, trained expert in transplant registry, coordination and patient safety, Chairman for Hospital Planning Sectional Committee, BIS, Government of India, Member Secretary, IPHS 2012 and 2022, Chairman for Biomedical Waste Management Drafting Committee, Environment and Forest, and sir was ex-director, National Blood Transfusion Council, Government of India. Welcome, sir. Well, everyone is eager to listen from you. Thank you.
So thanks to